first, we have Srilata. Srilata Remala is the founder of the Maternal Coalition. The coalition was founded with the goal to ensure that all new mothers have access to equitable care. And Srilata brings an extensive experience in the health and philanthropic field. And we are very excited to hear more about the work that you're doing. And next we have Rokea Jones, who is the organizer of this event, along with the Women's Commission. So please give a special thank you. And Rokea
I'm sorry, I have to also say this event is also co-sponsored by the Seattle City Council. They definitely donated some funds and support for this event, so we definitely have to shout them out today.
Wonderful. And Rokea is a mother to her brilliant daughter. She's a certified doula, certified lactation educator, a birth educator, a doula trainer, and she is also a member of the Women's Commission, and she's a staunch advocate for reproductive health and birth equity. And next we have Memorie Gladstone. And Memorie is a mother of 4 and a community-based outreach doula. Yes, hey! She is a community-based outreach doula serving the American Indian Alaska Native community, a member of NADAM, the Native American Women's Dialogue Against Infant Mortality. And she is also a lactation advocate and member of the Blackfeet tribe, and also a part of the Crazy Dog Society. And we are honored to have her here tonight. And last but certainly not least, we have Faisa Farole. And Faisa was born in Somalia, grew up in the United States. She's the mother of 2 beautiful boys. And for the last 15 years, she's spent working with women in healthcare and advocacy. She is a certified professional midwife with Global Midwifery and Rainier Valley Midwives, and really a pioneer in midwifery work in the community, and we are honored to have her here. Yes. So, we're going to get started on really one of the heavier notes, and we will move into the conversation from there. And so Faisa, Srilata, this question is primarily for you too, but also Rokea and Memorie, please feel free to add your thoughts. The question is around the upcoming conversation, well, long-standing conversation, but really upcoming changes with public charge. And so I would like to hear what you have to say as we're looking at the threats to health and safety and the well-being of pregnant and birthing immigrant and refugee families. And also, let us know how you think this will affect your work and the families you're serving. And also, for the long question, what are your thoughts on resistance and resilience in the midst of these changes and these attacks on folks' health and dignity? It is. It's a big question to start off the night.
I guess I'll just answer one part of it. When we think about systemic change and sort of what's going on politically in the movement right now, there needs to be a push and a move to respect women in general. I mean, we have the Title X issues, we have a really racist, sexist president, and within that, advocates still have to continue to fight for just our rights to be a woman. And that in itself is such a big fight to actually get to the crux of the issue, which is maternal health. And I think oftentimes we'll see big funders, for example, funding access to contraceptive care, access to abortions, but then there's this gap. It's like, do moms matter? Do we matter? Or is it just that we birth a baby and that we're like that vessel? So how do we switch those conversations now to move from, it's not just about getting access to contraceptives. It's not just about getting access to abortions, but it's our health and it's us. And we need to survive in order for communities to continue to be healthy.
Yeah, I'm just like that question is like what pushes what I do, why I'm in the field that I'm in, and because it's not what's happening what's happening in right now. It's not just happening because of the president that we have. Unfortunately, it's something that's been happening for quite some time, right? So what my colleague here was saying, what's happening, it's affecting all women across the board, right? But then it's affecting women from the communities that I'm from even more, right? So because you have what the underlining of everything that's happening right now, right? Especially with the maternal mortality and the satisfaction of care for pregnant women of brown and black. It's not because we're being let down by, the medical system has advanced significantly, right? But yet women that look like us are still having issues. And what that issue boils down to is racism, right? And it's also racism, and it's also people who don't look like you don't deserve proper health care. You know what I mean? So that's what's happening, and that's what we're seeing in in the doula. In the doula aspect of the people that I serve, and also definitely the type of women that also seek my care. Right now at Rainier Valley Community Clinic, they're seeking care, but from a person of color, because they want their partners to be welcomed, to be part of the care as well, and because they want to be respected of their choices, and because they want to be informed of their choices as well. And so it's sad, and in a way, I'm really happy that women are like empowered through this what's happening right now, and looking beyond resources that they necessarily otherwise would not have. But the work is, I feel like the work just started. It's a long way ahead, but it really makes me happy to see various organizations that are doing this line of work, like Open Arms, Somali Doulas Northwest, Rainier Valley Community Clinic, and also for people who don't necessarily look like us. We've had tremendous allies too, who are trying to help us in bringing this gap. So yeah, but the work is not. It's just started. But I feel like from my perspective, especially in Seattle, like there's so many women of color who are like in the doula work, who are going into midwifery, who are just doing so much work. And I think that's how we also overcome this disparities by having all this, exciting all these people that want to provide services back to the communities where this stuff is affecting the most.
Right, absolutely. Thank you. And actually, that's a great lead-in for the next question, which is for you, Faisa. Thank you first for the work that you are doing and the way that you've paved a path for other midwives of color in the area, and really nationally. It's not just a conversation about just this area. The work spans across the country. And I wanted to ask you how many midwives of color in the area that you're aware of, and what you already spoke to families who are connecting with you because they want to work with a provider who looks like them, who understands them, and who respects them, and who gives them the full experience that they should be experiencing as they're going into this new world of parenthood and birth, and that it's a family experience oftentimes. So I'd like to hear more about, and also forgive me, I didn't mention Somali Doulas Northwest, but I'd like to hear more about the work that you're doing there. And I'd also love to hear a bit about the birth bundle. If you could share what the birth bundle is and how that's helping and affecting families.
Awesome. So just to give you an idea of like women who are specifically, choosing, wanting to get care from somebody that looks like them. At Rainier Valley Community Clinic, where I practice midwifery care, I do a week. I do clinic there on Mondays. We had recently we had a client who she recently just gave birth. This client was coming to us from Hoquiam, right? Like I haven't even heard of Hoquiam like before her, right? So it was really like it was so touching that she was coming all the way from there to like Seattle to get care just because she felt safe with us and she felt welcomed with us, right? Like she would come and sometimes we would have lunch with her because she would come and then after her we'd have like chart review or something like that and we just invite her to have lunch with us, and she would accept it. So so the clients that come to us, there's a reason why they're coming to us. You know what I mean? And they wouldn't want to have it any other way. And so the birth bundle makes is a project that Rainier Valley Community Clinic is doing right now, and we got funded through BSK to do care. And this is midwifery care led, and we do collaborative care with doctors. We do collaborative care with doulas, birth doulas, postpartum doulas, and also lactation consultants. Again, these are accessories that come to free of charge to the women. And if you notice, these are usually services that are out of pocket, right? And these are services that make tremendous difference in women's lives. So for instance, lactation consultants, for them to come and do a home visit, it's like $125 an hour, right? And so, and it makes it feasible for women who are not used to, who need the services but otherwise would not be able to get access to. So, and we're so grateful, and it's one of a kind. Nowhere in Washington this is happening, and nowhere in the nation this is happening as far as this collaborative care that is led by a midwife, right? So tomorrow is one of our days where we have retreat with all the people involved, all the providers involved. And so it's really exciting, and it gets really, and the women that we work with, they want to make sure that their doulas also look like them, not just their providers. So this makes it possible as well, right? And we're getting so much excitement from the community, people who want to be trained as lactation consultants, people who, people like Rokea, I can't even tell you how awesome it is to be in a room full of birthing women, birth workers, who are all women of color, right? It's empowering, it's exciting, and yeah.
Can I just add that the birth bundle is so innovative because from the doula's perspective, we're often in the room supporting the family equally as isolated in that environment as the family is, if that makes sense. And so to be in a space where I get to meet with their midwife and their doctor and whoever other doulas, maybe their postpartum doula, we're all gonna meet, we're all gonna exchange information about how to support this family better, is mind-blowing.
Because there are things that the doulas are aware of that we, the midwives, might not be. There are things that lactation consultant has noticed that we have not. So there's this ongoing feedback that keeps coming back, and the client is the center of it all, which is like so powerful. Yeah. So yeah. So I don't know the other parts of to your question.
I know my questions are pretty chunky, aren't they? But what I would love to hear too is from the doulas. We have doulas who are doing such important work in the community and are connecting community-wide. And so I would love to hear from you, Memorie, about, we know that the American Indian community also suffers from high maternal mortality rates, and just as honestly all Black and Indigenous people of color do. And so we were also wanting to have you speak to what some strategies are in your community that you've seen that are helping to improve maternal health outcomes.
Well, so a lot of the organizations within King County that Open Arms and myself correlate with and communicate with and work with is the United Indians of All Tribes Foundation, the Seattle Indian Health Board, Mother Nations, the Chief Seattle Club, and all of these organizations hold a piece to provide holistic care to our communities. And so I was brought on as one of the first Indigenous community-based doulas to serve my community free of charge.
Yes.
And which is really empowering. I was also one of the first Indigenous breastfeeding peer counselors to be trained in King County as well.
Yes.
So my community is stepping into that direction. So we, as Open Arms, were able to help the Ina Macaw program, which is also through the United Indians of All Tribes, to create their own doula program, their home-based program, which they just completed their first Indigenous-based doula training. There's a Indigenous-based breastfeeding peer counseling training coming up too, that we're trying to train as many individuals in the community that have the same passion and the same desire to make differences and changes and impact our families and our next 7 generations to come. Nice. And so there's, obviously the movement that has been very public with just recently with the missing, murdered Indigenous women. And so this is not just an impact on the women, but it's also impacted on the men, it's impacted on the children. There's not as much data that is collected and collaborated for as many individuals that have gone missing. So the first impact is the women, because we are the ones that are birthing our children. And originally, we didn't have all of this violence. We didn't have all of this animosity. Women were not second in line. So in my culture, the women we are the head of the household. We are the ones that we run our families. We are the ones that make the decisions. We are the ones that host all of the ceremonies and the gatherings, and the men are our helpers. And so to have that changed through colonization has made a huge impact on our community. And so we're trying to transition that back to our old ways and our old teachings, but coming along with that is the birth and lactation, and those are things that we've always had doulas. We've always had lactation consultants. We've always had this support system, but through colonization that has been changed and that has been lost. And so now we're trying to bring it back through the roots. And so, and also educate and educate our youth, educate our families. I have 4 children, and so it was really it was a really surprise to me that the only reason why my children knew anything about lactation or birth is because of my profession. It's not something that they're taught in schools. It's not something that they're taught at home. And actually, our bodies are sexualized rather than, educated on what our bodies are actually used for. And so most people don't realize that, our bodies are made for breastfeeding, our bodies are made for reproduction, and it's a beautiful thing. And so to bring that back to my community, to bring the beauty, to bring the culture, to bring the teachings, the traditional teachings back along with, the traditional and first food, which is the lactation. So we're trying to train as many people, and I'm trying to impact as many people as I can. I actually had one of my clients is now a doula with us. I have another client that is now working towards her IBCLC. And so trying to push as many people into what their passions and their desires are, and to also help make an impact in our community. And all it needs is, the desire, and all it needs is that passion. And there's so much shame, and there's so much hurt, and there's so much hatred, and there's so much self-doubt in my community, which has come through historical trauma, that those are the things that we're trying to change. And so, not only am I, I'm a trained lactation counselor, a trained doula, but also I wear many different hats in the community. I'm also a restorative justice facilitator for our school district as well, to help our children of color have a voice and a foundation when they are suspended or expelled, because people of color are less likely to be tolerated. And so they're automatically, oh, you're expelled, you're suspended, and then automatically they're pushed down the path to prison or in jail. And so trying to make those changes, and all it is support. Support goes a long way. Education goes a long way, and just having somebody to be able to talk to, and that's the same color as you. Trust is a huge, huge thing in my community. And so there's very few that are birth workers and lactation counselors. And so I'm trying to bring that forth, because it all starts in the very beginning with our pregnancies and with our babies and with lactation, and normalizing it and supporting the family as a whole. That's going to impact our children to grow up to be healthy, successful adults. And so if we can start from the very beginning and work our way forward, there's a lot of work, because we can do all the work that we can, but then there's racism and just so many other factors that are involved on a regular basis. And with our president in the White House now, I've been seeing a lot more of it lately. I've been having to stand up for people that are being victimized in my own community. And just even at a grocery store or a parking lot, these are things that just are unnecessary. And for all the steps that we're trying to move forward with to these changes and these impacts, it does start with a birth, but it also starts with re-educating and re-enlightening, everybody. And just with my kids, from my culture, hair is our strength. And so I've had to actually go through and create my own, stepping forward for my sons, because I've had to cut their hair before they get into school, because they've been so criticized and bullied based off of their hair, and to the point where it made them question their own identity. Mm-hmm. And so I've had to go in and I've had to educate the class and the teachers and educate people at parks, just because they're not aware of our culture or our norms. And so it's something that's impacted my family. But along with the maternal health, I just recently lost a really good friend of 21 years based off of the care that she did not get in the hospital, and she lost her babies. And so that's something that's still happening today. And it's really frustrating, It makes me very angry and very sad. I had to take some time away because I'm doing this work, and I want to make an impact, and I want to make sure my people are surviving, and our babies are surviving, and our families are thriving. And still today, when medicine has come so far forward, we're still so far behind if you're a person of color. And that's one of the things that we have to change is racism. We can go so far with our work and we can go so far with our medicine, but if we don't change that mind frame, none of it matters. None of it is going to make a difference. You're still going to be hitting that wall, but you have to change that mind frame. Thank you. I don't know if I answered all that, but...
You did. Thank you. Does anyone else have anything else that they'd like to add just to the conversation around what educating people has looked like now, in whether you're in the hospital room, in the community?
Absolutely. Yeah. I often share my experiences, my stories of my first bit of advice to my families is to ask for a minute, right? And then that way they have enough time and enough space. The providers can leave the room and can allow them to process their options and think about what it is they'd like to do. That also allows me as the doula to kind of educate the family on what their rights are, what types of additional questions to ask, or even if that means asking for a second opinion. And when I think about this topic of education, I really love how Memorie, you explained it so eloquently, but I think what's so integral is the thought around how education starts in the home and how it starts in our community, and it starts with the people we live with. It starts with our neighbor next door. And being able to, when you hear things that, you know what, that's actually not right, friend. That's actually not true, friend. And being able to call people out and share what you're learning. You're obviously all here to learn about this work, to engage in this conversation. Take it out there. Take it home. That's where it needs to be happening. Thank you. I had the opportunity to create a placenta print, which for all us birth nerds. So essentially a mother's delivered her baby's delivered placenta. I take the placenta and I essentially press it to paper and literally make a print. And I got to paint it, make beautiful colors. And so what I did is I set up a painting space with me and my daughter. And I set up a place for her to paint, and I set up a place for me to paint this placenta. And I got to talk to my daughter about sorry, I'm getting emotional. I don't know why. But I got to talk to my daughter about what a placenta is and how it works and the importance of it and how beautiful it is and, what a tree of life looks like on a placenta. And she got to help me paint that. And that to me is just so powerful to share about the power of the body. What I like to describe to my families is the divine intelligence of the body, how intelligent, how it knows what to do, and how, as birth workers, my first job is to teach people to trust your body, trust your gut. You know your body. And we've all talked about Serena Williams a million times. I'm sure that story, everybody's heard this story. But what I like to go back and point out to people is that Serena Williams knew her body. And she is a beautiful example of what self-advocacy has to look like. Sore, just had a baby, uncomfortable, feeling like this other thing inside her body crawls out of her bed to the nurse's station to say, hey, I know my body, something's wrong. And the power of that and how when we're educating people, the power of advocacy, self-advocacy, and knowing thyself. And that's what I love when I hear Memorie talk about how she's had to advocate for her boys and teach them about knowing thyself. The westernized medical system is unfortunately so compartmentalized. And what you hear us talking about up here is how do we reclaim that? This is not a new concept. A doula is not a new thing. A lactation consultant is not a new thing. As long as there have been a person birthing, there have been people there to support that person, just period. When we talk about our history with midwifery, and we talk about what happened with the granny midwives, and when the medical system decided they wanted to grow and they wanted to make some money out of this thing, and they wanted to create what they wanted to create, how it erased all of these beautiful traditions that made birth, that really made birth what it is, that really made it the experience that it is, the joy that we keep trying to convince people, no, it's fine. When you talk to people, you're like, tell me what you know. And they're like, well, it's gonna hurt. And you're like, well, yeah, but there's all this other stuff. And I can go on and on about that. But yeah, just the reclamation, the knowledge of self, and the self-advocacy is really what's going to get our families through, and the system will eventually catch up, we hope. When I started as a doula in like 2006, 2007, I remember that we were begging for delayed cord clamping. We were like, please, we were begging for skin to skin. Now, you go into the average hospital and they're like, oh yeah, we do that now, we do that. And still sometimes I'm like, that wasn't long enough, but still. But still, they're doing it now. And so now we need to ask for this next level. It's time to bump it up. Those things were actually small change. Those were easy things. And so that's where I said, I have a relationship and partnership with everyone here on this stage. And that's how I show up for the work. I'm mentoring new doulas. I'm training new doulas. I'm trying to get the ball rolling. Yeah, thank you.
So one thing we're trying to do is work with community health clinics. We cannot eliminate the providers, unfortunately, because that is the way that our system works. And so I literally had a conversation with a very nice white doctor today. He's a pediatrician. And I was like, we can't eliminate you, but how do we reduce the amount of time that we spend with you and increase the amount of time that we spend with these women on the stage? And so the idea is we need to now transform healthcare. We need to start making the doctor the reason that women are going to the clinic, but that we make it so it's a community health worker, it's a community member, it's someone that has been trained, who's within there, that checks them in, that schedules their appointments. First person they call when they are feeling ill, instead of having to go to this doctor within a clinic and call some nurse line. Like, we have to eliminate all of that within healthcare in order for the system to truly work. And so transformation within healthcare is gonna be slow, but how do we push it along with having all these amazing community health workers on the ground? And the great thing is, from a insurance perspective, the birth bundle is exactly what we call value-based care, which is that now we can have payments be not just given to providers because they caught a baby or got a baby out, but now it's that Rokea gets paid, that Faisa gets paid, that everyone gets paid for the work that they are doing to support that mom and to ensure that that baby and that mother is healthy. And we're moving towards that, which is super exciting. And then the third thing is Medicaid billing for doulas is going to hit next 2020? It's hitting in 2020, which is very, very exciting. But also remember that there are barriers to entry again. So, you have to report X amount of hours that you spent with the mom. Usually Medicaid payments come almost a year later. And so all of these things are sort of like what we're fighting in the system. And we have to consistently change that. And I think it'd be really exciting for like a community health clinic, for example, to finally value the role of community health workers and say, I am ready to give up part of my payment to you because I recognize the work that you're doing to support the community and to ensure that moms are showing up for their prenatal and postpartum appointments and that they're healthy and that they're surviving.
I wanted
to bridge that gap of trust, right? Like Memorie said that so beautifully, to talk about how in our communities, trust is a big thing. Communities of color actually have a really dark and twisted and really unfortunate relationship with the medical system, which is why people aren't utilizing it as much as they should. I think the average adult, any culture, the average adult is not getting their physicals. But that's because people have a different relationship with that system. And in many parts of the world, people go to hospitals to die. You know, it's only in our westernized countries where we're going to hospitals for everything on the spectrum. And so being a bridge to help families really learn how to utilize the system and when to trust that their body will take care of itself.
I wanted to add, this is something that a lot of times comes up with the medical professionals, is that they're pretty eerie about doulas and like out of hospital midwives. And like they think that we let women do whatever they want, right? Regardless, you know, for the sake of having a natural birth, right? So, but that's not true at all. So our goal is we are trying to make a dent in maternal mortality for Black and brown women in this country. And to make that, it's not to make it worse, we want to make it better. So, and to do that, we as midwives, we know our boundaries, and we know when women are risking out. So when they get to that point, then we seek for medical professions. The same thing, the doulas, they're there to empower the women, not to impair the women, right? Like, so meaning if a mom wants to have a C-section, if a mom wants to have planned epidural birth, that doula is there to support that mom. So we are not doing anything to impair the women or to hinder, you know, or like to cause this friction between the medical professionals and the mom herself. We are there to be this, you know, a support to make sure that the outcome that we all want happens, while the mom is also happy with her outcome too, because that is a big thing that a lot of times gets overlooked at, you know, for the sake of having a healthy outcome, you know, a healthy baby, the mom's needs are overlooked at. So just making sure that that happens. And one of the other things that I want to say about, you know, making transformation is to make sure that if you are a person who is in a position to help, you know, a student of color who wants some preceptorship, you know, who wants some mentorship, just to show up and take them in, because that's one of the reasons why also that we can make a better outcome of what's happening for Black and brown women, because obviously whatever has been happening, it hasn't worked. So this is one other ways that we can show up in supporting, and that's like the mentorship that Rokea is doing, I'm doing, and Memorie is doing. That's how you make a dent in this in the system that's pretty much broken. Yeah.
Thank you. Thank you so much. So as we've kind of touched on conversations around Doulas for All and talking to about the historical work that granny midwives did, they were birthing all of the babies, Black and white. What now we know is that the medicalization of pregnancy and the legal regulations that were forced upon these midwives who were practicing, and the switch to a very patriarchal and viewpoint that it's something that you do need to go to the hospital and do, and your body doesn't know how to do it. This real significant switch effectively ended the work that the granny midwives were doing, or the way that they were able to do it, and stigmatized the work that they were doing. And so we're seeing now a resurgence of bringing back traditional ways and reclaiming the truth that we know our bodies naturally give birth. Our bodies have, this is how we all got here in one way or another. This is how we all got here. I think that people forget that, like literally, this is how we all ended up here. Somehow. So there are times where medical intervention is necessary and important and vital. And there are many more times that the process will naturally unfold. And then there are other times too, we have folks who are needing medical support by the way that they are getting pregnant and their needs in supporting birth. Because we also know that not all birthing folks identify as women and mothers. So we also have other folks who are needing some medical support in birth, but the process itself is safe, it is healthy, it is natural, it is birth. So as we're talking about regulation of doula's work and, you know, the expansion of doulas for all and Medicaid coverage, are we concerned, are there concerns about how this might affect doula's ability to continue to practice, as there's been conversation around regulating what is acceptable doula practice and regulating the regulation of, you know, the certifications that are required for a doula to be paid, and just other layers that could possibly add to the difficulty of doula work continuing and expanding, as opposed to it being something that more women have, more birthing folks have access to. So can you all speak to both sides? It's a double-edged sword, right?
So I'm going to talk about something a little bit controversial, but this is a great example of what we're afraid of. The Department of Health recently put out a birth equity grant. It was close to $1 million over 3 years. The language was specifically designed for community-based organizations. And about a month ago now, they released a statement, and they had given it to a couple large health systems. You know, from my perspective, I believe in systems change. I am very much about, you know, health systems starting to integrate doula services, but doing it in a proper way. And I think this sort of movement of saying we're going to be community-based and we're going to give these dollars specifically to community-based organizations, and then giving it to a health system that makes $1.8 billion a year was a little jarring. And those conversations, when things like that happen, that's when we all fear for doula services. We want to make sure that there's people out in the community that are billing Medicaid appropriately and that are treating women equitably and that are giving the services out to the right people. And I'm not a community-based organization, and I will fully recognize that because we're more systems change. And I personally was very upset by who got the grant. And there are other, I think there's been a lot of talk about, like, what do we do? How do we change the conversation? And how do we make this more about community-based work? And I would be curious to hear from all of you about sort of your thoughts on it too, and how it changes the scope of your work. Because I think as we're sort of looking down at what does Medicaid billing mean, what are the requirements that we need to advocate for that will make it so that we know that the right services are getting to the right people?
Yeah, thank you for talking about that, Srilata. It was definitely jarring, and it makes me think about the approach that these larger systems are taking. And I'm wondering, some of the choices, some of the steps that have been made leave me wondering, are you really interested in serving people, or are you just interested in getting into the community-based market and what that means? I actually was having a conversation with someone today, and was saying to them, which I'm sure they know too, I was like, I'm preaching to the choir, but to me it seems so important that we build partnerships, that these larger entities sponsor, support, build a partnership, build a bridge, empower a truly community-based organization to do the work, and you show up and support them in that. You show up and educate your staff, educate your providers on how this partnership can work and the significance of that partnership. I think when a larger $1.8 billion industry entity can really affect change, share the wealth, friends. Share the wealth. trust in the expert. I am sitting with a panel of experts. Trust the experts. Those are the things that come to my mind. And what I'm seeing is the hospitalization of even doula care, of what midwifery care can be. And while I am grateful for families having more access, I'm still wondering, is this service the same when you become a part of that system? What does that mean when they cut the check? How much advocacy can you truly do for that family when your livelihood is incumbent upon this larger industry, this larger entity, these larger hospitals or what have you?
So I can only speak from my culture, and just because I've worked and I've been in my community since I was an adolescent, and from my family experiences, from my client experiences, from most of the experiences that I've had here in King County, most of the programs for my community that are going to thrive are only going to thrive if they are people of color from the community. And that's one of the things that we're trying to change, is to train and to educate as many people from the indigenous community as possible, because my community is not going to go to anybody else that doesn't have the same face, that doesn't come from the same background, that isn't from the same community. And so that's one of the reasons why most of the organizations that are creating and implementing their own doula program are going to the doula and midwifery programs that are indigenous based. Now, there's only one other there's only one indigenous based doula program, and that's on the Yakama Nation. And it started off as a pilot program, and it is not government funded. And so the training that is being trained through the indigenous community is actually coming from Canada. And that's one of the only indigenous-based midwifery programs. So we're getting back into our cultural and our traditions and practices to serve the community. And so as far as that goes, unless it's indigenous-based, that other system is not going to affect my community. It's not going to be impacted by my community. And most of my clients and most of the people that I talk to in the community and the organizations, the hospital setting is the last place that they want to go. So we're referring to midwives and doulas of color because they want that familiar face. And so even though this $1.8 billion entity may have that grant, they're not going to touch the indigenous community unless they sponsor one of the programs.
Can somebody help me out? There's a term for when you kind of fall in love with the abuser, or you fall in love with the oppressor. Thank you. So for my community, that's what we're experiencing. I honestly feel like it's going undiagnosed, the amount of Stockholm syndrome that the African American community experiences. It's going undiagnosed, the amount of PTSD that the African American community is experiencing. People don't really know. They point to other certain symptoms, but if we really got to the root of it, we're talking about PTSD. We're talking about how the effects of, specifically for the African American community, how the effects of slavery continue to trickle down into the ways that we think and the choices that we make and the ways that we feel here as a person living in America. And it's so interesting. I always tell people, especially people from other parts of the world, what's happening is that the Black community is really a thriving community that's really grown and birthed so much about American culture that gets swallowed up under the umbrella of America. And we are slowly erased. And so by the time it gets out to the rest of the world, it becomes America, and we are erased for our innovations. And that erasure, that dismissal, that, erasure, dismissal, the ignoring of a particular culture and their needs plays out in every area, in particular healthcare.
So what I've been experiencing as the ED of Somali Doulas Northwest, our organization is a little over 2 years old, is that a lot of times funders won't fund us because we are unknown, right? And it's easier, we're unknown, and people have a hard time thinking that we can lead, organizations, and we can make a difference while leading those organizations too. So, and it's been really difficult and hard to be funded. Along came BSK. Where's BSK? BSK is in the house, by the way, today. Yeah.
So for folks in the room who don't know, BSK is Best Starts for Kids.
Yeah.
It's a very large initiative that has been making it rain in Seattle on community-based, culturally competent. Yes, so Michelle Sarju is here. Michelle Sarju has also been the only Black midwife in the state.
That's right.
For over 20 years. Not anymore, thank goodness. But the fact that was in existence blew the top off of me. And so I really cherish and honor Michelle Sarju, and the work that she continues to do for birthing families is pretty freaking amazing.
There's Melanie, too. Who's
Melanie's here.
Melanie's here.
She's hiding.
She's
Hi,
hiding,
Melanie.
yeah.
Devon is here.
So,
There's a lot of BSK folks in the room.
True.
Devon.
Yes.
Devon's in the back. Yeah, absolutely.
So,
Yes. Yes. And can I just say, for folks of color, we like to describe it as the system is broken. But what I want to challenge you to think about is the system works great. It works great for the purpose and the intention it was created for. It works great. So if we really want the system to work for us, we need to think about how can we rearrange that system? How can we break down that system and create a system that actually can maybe be broken one day so that we can then fix it, right? Like right now, it's working great. Trust is working fantastically. People are making the money they want to make. They're getting to practice on women of color and get to the distinctions and levels of doctor professionalism that they want. The system is using folks of color the way it always intended. If we go back and look at the history of gynecology, which I've sat in this room and talked about, we talked about Dr. Marion Sims and him practicing on black slaves without anesthesia or any kind of medication or pain relief. And there's no known history of Dr. Sims working on anyone other than black slaves. And so everything we know about gynecology today is because of my ancestors.
Well, in my community, we have several women that were sterilized without their permission, without even knowing until they decided to go and try to have a child. And it was something that was done at a very young age. And in the residential school systems, vaccinations were tested on my culture and starvation. So they divided children and they're like, let's see how they tolerate this vaccine. Let's see how they tolerate this vaccine if they're only given this amount of food. And the children were brutally raped and beaten. And these children that bore the babies of these priests, these nuns were literally throwing them into the fire and burning these babies and trying to hide that from the families. And these children were grown into such historic trauma, so much so that it is PTSD now. Now that we're recognizing it, it is PTSD. The abuse, the sexual abuse that has trickled down. I'm only one generation away from that, from the residential school system. My dad was actually taken away from his family at 4 years old, did not speak English, was put into a residential school system, taken away from his family. His mother died when he was in there. My grandmother died when he was in there, and so he had to stay in there. And so that has traumatically traumatized him from having a healthy relationship from that point forward, which has drastically impacted my family. And so that was one of the reasons why I wanted to make that change, because I didn't want my children, my firstborn being a female, I didn't want her to go through that. And I am doing my darnest to make sure that she has the support and she has that voice and she has that education to make a difference as well. But I'm only one generation away from that. And so people think that that was like, oh, that was hundreds of years ago. Well, actually, no. That was, my dad's 72 years old, so that wasn't that long ago.
Can I say one more thing about funders? Someone today gave me this crazy advice. I was like, why is it that we have like 5 foundations in the Seattle area that have like over $1 billion, yet I think one of them, Perinatal, is the only one that's really investing in maternal health. And she told me, she goes, you should just find a white co-founder, because that's the way you're going to get the money. And I sort of was like, maybe you're right. Is that the way that we have to do this? Like, how do we convince these people that are holding on to so much of the wealth in our city that this is such an important topic? Like, I truly, out of all the foundations that exist within our city and in the philanthropic space, I can literally think of one that has been giving a significant amount of grants. And so just from like your own, if you run into people who work in these foundations, a lot of us have friends that work in these foundations, talk their ear off about why you need to invest in maternal health. A lot of them are doing 0 to 5, so that means out of the womb, up to 5 early learning, but they skip over everything before. And so convincing them that we need to invest in Somali doulas Northwest, that we need to be investing in open arms. It's so important to have those conversations and to constantly be talk about it at a bar, at a restaurant, wherever you are, start talking about it, because we cannot make change unless all of us are sort of together and talking about why this work is so important.
Yeah, and to me, I feel like, I shouldn't have to have a white coworker in order for me to get funded. You know what I mean? Seriously, I shouldn't have to have that. But unfortunately, I'm actually, I strategically made my board out of women from the Somali community, because I feel like they will know, they can advise me better in running this organization for the community, right? But I'm having to think, I just interviewed my first white board member. You know what I mean? Because I need him to be on board, so that way I can get the interest of funders to look at us and actually fund us. We do good work, and we have the numbers to show it. So we don't slack around, I promise you. But it's really sad that, that thought is even there. Yeah, it's really sad. Yeah, and then you wonder why nothing is changing in our, you know what I mean? And obviously the way things are working, our things are not being done the way things are. Yeah.
Yes, it's the nature of the beast.
Yeah.
Yeah, you guys, it is almost time.
It is.
And so I wanted Srilata to talk about the 40 and 40, please. And then my silhouette is naked. You guys are leaving me naked. What is going on? I am naked. My God. So, Srilata, if you can please share with us about this wonderful distinction. And then people, please paint. Please paint. Here we go.
Okay. I was actually really shocked. So this is the third year I've been nominated. Usually there's like one or two women of color that they select, and oftentimes like you have to be like a lawyer, a CPA, whatever. And so I got nominated again this year, and I got the award, which was super exciting. And I think one thing that, thank you. Yeah, it's like 40 liters in whatever, the Puget Sound area. So, one thing that I was given a platform, right? So I was angry, and I voiced very strongly how important it is that we need to be focused on women's health and maternal health. And I think they're a little bit scared of me in some ways. But I think what was so exciting about it was that there were people who are in the business world who are like, we need to give a platform to this, and we need to make it a thing. And so I'm just hoping, and I'm so grateful to have it, but I'm just hoping that it lifts up the work that's happening in the community, and that we finally get some change that's so deeply needed. Again, like things like the Department of Health stuff really just feels like we took a huge step back, but whatever platform you can use. Like I know there's a lot of really influential and amazing people in this room. We have people who are working in corporate at the highest levels. Make it a thing. Always vouch for the people who are having babies. Never question, if they need to go into a breastfeeding room. If they never do that. That's really toxic behavior. And so how do we, even within our own organizations and where we're working, sort of shift the conversation to support, I think is really important. So there's always a way you can do it, and just find that way and be the voice.
Thank you. So, yes. For the last question for everyone, please share what folks here and in the wider community can do to support your work.
I think the biggest things have been said. Talk about this at home. Talk about this with your neighbor. Talk about the things that you're hearing, the things that you're learning. Talk about what's on your heart. Just continue to share. If you can volunteer with an actual community-based organization, please do. If it's called on your heart to actually start doing birth work, please do. There's a large growing community where you can find support. You can find sisterhood, brotherhood, peoplehood. Believe it or not, there's actually one male doula that is working in the city. I love him. I call him Papa Doula. His name is Jessup. He's cool. Write about this. I'm going to write about this after this, but write about it. Keep talking about it. Keep celebrating it. Keep celebrating each other. When you have someone who's birthing in your home, in your family, share this with them. Share this with them. Share this with your babies.
I would like to piggyback on that and just educate. And if you see a person of color in question, or if they're self-doubt, reaffirm. We're constantly getting shut down. We're constantly getting questioned on our expertise, our education level. How long have you been doing this? How many births are you doing? How much experience do you really have? So if you see a colleague doing that, or a peer, or anybody, try to change that mind frame. and educate the children, because there are future generations that are coming up, and they're our next leaders, and we need to change that mind frame from what's going on right now.
So just be okay for women to have options for her, whether she wants to birth inside the hospital, outside the hospital, with a doula, without a doula, natural birth, medicated birth. Just be okay with that. Yeah. Yeah. And as far as how you can support Somali doulas, we always need volunteers to do various work for us, and you can always donate money. So you can always you can always purchase a birth doula for a client. You can always donate stuff, because we do give supplies as well, baby items to moms, in particular refugee and immigrant moms. So somalidoulas.org is our site. And if you want to just come down and ask more questions, learn about our organization, you're more than happy to as well.
Wonderful, thank you.
Donate. Donate to these orgs. I mean, I don't know what else to say. Like, they just do such great community-based work, and I think it's super important. So skip coffee for a week and just donate that money. I guarantee you it'll be put to good use.
Thank you, thank you. So we would definitely like to invite people to go and contribute to the artwork over here in the corner. But we also wanted to save some time for folks if they have questions. So if there's anyone who would like to ask a question of these minds here. Yes.
Hi, so I'm an incoming medical student at UW, and I'm actually here with some other medical students, and so, yeah. So I was wondering, you talked about like the role with providers and other birth workers. What would be your advice to like upcoming health professionals and how we could work better with birth workers?
So I would say just be open-minded and affirm the families, educate as much as possible, because a lot of the times what happens is the families are kind of like pushed in and out like cattle, and the nurses come in and they're like, we're doing this, this, and this, and the voices aren't heard. Their wants, their needs, their desires aren't heard or even accommodated. And so just be open-minded. If they have a doula, make them as welcome as possible, because that's not always the case. And make sure that the family as a whole is supported as well.
Yeah, I would say be the ultimate host. Invite people to ask questions, invite other birth professionals in the room if they have any possible suggestions, and you as the provider can always say, okay, this is the information we have about that and why that choice might work or may not work, but you don't want to take anything personal, and I know that's what you're taught in the profession, but in a situation, I've been at births where I was told there were too many cooks in the kitchen, where providers felt threatened by my presence because I had a suggestion that I know works. And providers sometimes get, on their plan, we want to do this for this family, this is what we're going to do, this is what's going to happen next, without allowing for time. And I don't know if that's a hospital policy-based thing, but if you can allow for as much time, give families time, give families time to ask questions, give birth time to happen, give other providers time to weigh in. Yeah. Yeah. Yes.
Can I just add that for providers, especially white providers?
Oh yeah.
I would say, especially for white providers, to commit to a racial equity lens in all your studies and your work, and insist that all of the classes and coursework and preceptorships that you do also commit to that. And if they don't, push it. Don't take no for an answer, because all of this is hinged and based on a racist paradigm, and all of the inherent bias that providers are bringing to the system that's working exactly as it was intended. And if the players don't change, then neither does the game.
I also just want to say thank you for coming, because I think it's oftentimes hard to get providers in the room to have these discussions. And then secondly, I read this article in the New York Times about how medical students were doing pelvic checks on women to learn when they were in comas or they were in the ICU. So a lot of the women who were in the article were like, we just did it because we were told we had to. But when you're in that sort of situation where you feel like someone is saying the wrong thing or doing the wrong thing, speak up. Because even though it may suck in the moment, and I know it's really high pressure, you guys are doing amazing work, just speaking up. So make sure you do that.
Absolutely, thank you. Something else that too comes to mind is really honoring humanity. I feel like that's the piece that it's slipping away in too many moments now. It's really easy to be numb and to just kind of move forward in a groove that's already been set forth. And so remembering the humanity of the person who you are working with and remembering the humanity of yourself in each moment is more vital now than ever. Are there any other questions? Yes.
First, I want to thank all of you. It's been a great learning experience, and I can't wait to go paint, but I've been listening. So I actually I wasn't going to raise my hand to take time, but your comment about humanity. So I work on training providers how to manage birth emergencies. And one of the things, we were talking to a group of folks on a pitch about our business, and it was one woman and two men. And the two men, we do very low-tech approaches. It's very much about humanity and humanizing the situation, both for the providers and for the mothers, so that the providers also know that we see that they're under stress and how can we support them in terms of what they need as well. And the gentleman said to me, where's the next step in the tech for this? Can we do simulations on the phone? Is there virtual reality? And I said, I don't know how to tell you this. Like, this is the most human experience there is. There's a human being who's pushing another human being out of their body. A tablet isn't going to fix this. But my question to you is, how do we get your voices, this conversation, how do we put those two rooms together? Because
have a panel, host a panel at your space. We'll come.
Please help me, because I felt like I was the only woman in the room who was just saying, like, this isn't about your phone or about some sort of crazy data visualization. This is a human. Why are we limiting the human part of this? How do we bring this back? And I feel a little bit alone in it. And sitting here tonight, I was like, oh, thank God. I don't feel so alone in trying to figure out how to do this. But I feel like we also need the conversation about humanization, but from women of color. So I feel like I need to stand with you in front of these gentlemen and say, no, stop that. You can't, and this is what a lot of the funders also say. They're like, where's the high-tech part of this? I'm like, there isn't one.
This is high-tech. This in here is high-tech.
Right.
That's high-tech.
Thank you.
This is as high-tech as it gets. This is the most high-tech thing that's ever been invented. I think I speak for everyone on the panel. I say we would love to come your next staff meeting, your next staff retreat.
It's not my people.
We'll hang out with you, share our stories. And I think, sometimes it's hard to see yourself. You think like you're chugging along, you're doing your thing, you're doing your job. And when you bring an outsider in to say, well, this is actually what I see, and this is what I see you doing, it can be a little shocking. And people are like, oh, I didn't think of it that way. So, it might be helpful to come in and bring in a large group of new perspective.
We, on July 18th, we hosted a collaborative. Actually, a lot of people in this room were there, where we talked a lot about, we had a lot of community health workers, we had a lot of doulas, just people talking about some of the barriers to entry for women of color in maternal health. And I invited like 40 providers, doctors, and they refused to come. Every single one of them. I invited another midwife practice, and last minute they're like scrambling and no one came. So it's just, they're not, and if you could host something like that, you know, you bring your providers to the table and then you invite the other people into the room, I think it would be really powerful. You and I should connect then. I can help you with that.
Yes. Thank you. Thank you all for putting this on. I have a personal question for all of you. So I'm a licensed mental health therapist, and I know that this is extremely hard work. I specialize in racial trauma, and you all are working within this oppressive system that isn't going to end tomorrow. So I really wonder, what are you all doing to care for yourself? Because I can tell that you're extremely passionate about this work. Yeah. And I would hate for you all to be burnt out, so I'm just wondering, like, what do you do to make sure you're okay at the end of the day?
So can I?
Here's a therapist right here if you all need another one.
I actually don't have a good therapist right now. I need one. What's that? Me, you, what's that? Oh, boom. Yes.
Do you guys have cards?
Yeah. Leave cards. Yes,
Good.
So I can speak on Open Arms Perinatal Services. So we actually, they are really supportive of our work and individual work that we do. And so when we need the time to take off to decompress, they're totally on board with that. We also have reflective supervision with Annie. So consult through a lot of the stressors that we deal with in our professional lives, also in our personal lives as well, because not only our work doesn't stop when we leave the hospital or the midwife clinic. With my program, I'm with the family up until the baby's 2 years old, so that there's a lot of different stressors that we come across. And so we also have a lot of like group reflective supervision. So we're actually like a big family. And so I can call anybody at any point in time and be like, hey, this is what's going on, you know, or if it's just like you just need to get something off your chest or need to just talk about anything, you know, we have a really great supportive staff.
Yeah, I think I would, at our organization, we do a lot of, especially after each birth, just checking in and seeing how it went. And just listening sometimes is the only thing that the doula needs, just listening. And then, and sometimes I actually get calls from the birth while the doula is there because a nurse is being difficult. And the doula is, because the doulas have to be cautious not to be kicked out. Right? And just like what to do. And so there's a lot of, that happens. And so we do, on Tuesdays we have like phone conferences at my organization. And then we also do like monthly reflective supervision that I do with each of the doula. And we try to have like once a month lunch. It doesn't really work because of everyone's schedule, but we do that just to kind of debrief about what happened and how to approach things. But I know it's something that exists, stress. That's something as a mentor to like new student midwives, that's something I try to help out with because there were things I wish that I had in place when I was student midwife, being one of the only person of color student midwife, and it's not an easy thing to be, like the anomaly of a field, kind of, so to speak. So it's always good to, and that's, in a way, that's my way of giving back because I know how it felt like being there and not having anyone to, except my partner, to just kind of spill everything out to. So it is a stressful work, and a lot of times it's disgusting what human beings do to other human beings, And the problem is, especially with my community, if every time somebody did something horrific, they sued, it wouldn't happen. But the thing is, they won't sue because they say we can't go to the hospital. They have this mentality that they can't seek health care anymore if they sue a hospital, that they're gonna have this like, red tape in their file or something like that. But some of the things that happen is really disgusting, and it's like I can't even bring myself to bring it. Yeah. Yep.
It comes in bits and pieces for me. Like I shared earlier, I got a chance to paint and create a placenta print, and was actually feeling really overwhelmed and overworked and stressed in that moment. But I was like, I gotta do this print and get it to this mom, and actually felt really cathartic and just really peaceful to paint, which is why I brought paint. No, I'm just but yeah, no, that felt really peaceful for me, and just finding those moments. Being at a birth never gets old. Part of that is hormones. But also the other part is it's always amazing and beautiful. And to be enveloped in a room with all those hormones, but to be a part of such an intimate moment with a family when their baby first comes out, and to be around all the joy, all the tears, all the excitement is always a beautiful moment. It's a win. It's always a win at the end of the day. So there's that. It's always that.
Well, thank you. So the time is getting pretty short here. I know you don't want to make it in, right? You don't want to end. We might have wrap it to the art. Yes, I got the high sign to wrap things up front. So I want to thank every panelist here. Thank you again, Rokea. Thank you to the Women's Commission. Thank you to the Riveter. Thank you to the Seattle City Council. Yes.
All the credit goes to Rokea for putting this together. This is not easy, so thank you.